Chapter 2. Forward. Meaning of health among Africans. Before I started writing this book, I conducted a small study to know how average Africans define health and what they know about mental health. The degree of importance given to health by a country determines the level of attention and how seriously the people take the different dimensions of health. People's ideas of health and being healthy vary widely. They are shaped by experiences, beliefs, knowledge, values, and expectations, as well as views of what they do in their everyday lives and the level of wellness and fitness they need to perform those roles. Outmoded definition of health. The major fact is that healthcare in Africa is still backward as it was in the 19th century Europe and America. Health has been found to mean more than the absence of diseases due to the better understanding of the implications of psychosocial, cultural, and spiritual factors as determinants of health status. These factors also account for the chronic pains and influences on medical/physical illnesses, such as heart attack, diabetes mellitus, arthritis, blood vision, etc. Thus, the definition of health ceases from being the absence of biological disease to become biological, psychological, social, and spiritual well-being. Mental illness, not opposite of mental health. Health is physical, psychosocial, and spiritual. As health is not the opposite of disease, so is mental health not the opposite of mental illness because complete health is not easily attainable. People usually have one thing or another that impinge on their body, mind or spirit at any point in time. The ability to maintain healthy lifestyles and to avoid stress or conflict determines the level of mental health. In other words, all human beings drift between health and illness and between mental health and mental illness. To understand more the facelessness of mental health and mental illness, I would ask the reader to consider the Europeans' impression about Africans as a holistic entity without much regard to the individual countries, subcultures, and other differences. So do we as Africans erroneously view mental health and mental illness as two opposite human conditions that imply either not mad or mad? Scope of mental health and mental illness. Similarly, as South Africa is only a section of Africa, so is mental health an aspect of being healthy, but unlike South Africa with its boundaries and easy location, mental health is very hard to identify and has no clear boundaries, since it can only be identified from cultural perspectives, the pattern of behavior, and lifestyles of people. Furthermore, it would definitely look so shabby and incomplete if one draws the map of Africa omitting South Africa. In other words, mental health and illnesses are a very vast and important area of health that deals with various aspects of an individual's social, biological, psychological, and spiritual well-being. It is the ability to live comfortably with oneself and others, to understand and accept one's feelings and to make mature and appropriate responses to situations. Effect of ignorance. The irony of ignorance about mental health in the African healthcare system result in victims of mild or severe mental disturbances being taken to hospitals for drugs, X-rays, EEG, and other medical assessments that complicate issues. Diagnoses are made on the basis of effects of symptoms, not on the holistic causes of symptoms. These effects manifest mainly on the body organs, thereby becloud the importance of psychosocial and spiritual causes of symptoms. In this regard, it may be pertinent to know that an average African defines health as the ability to perform normal functions of living without any hindrance caused by disease or infirmity. This is the beginning of our big problem with health in Africa. I am healthy, so far I can get up and go. This mindset becomes flawed when one considers the current issue, which emphasizes the influences of psychosocial factors in the causes and escalation of physical and mental health problems. Bias in psychological tests and assessments. Psychological assessments tools such as the psychological test, projective test, and psychometrics, which often lead to clinical diagnoses, are today polarized among clinicians and laypeople. There is growing controversy in the use of Western standardized tests with minority ethnic groups. Long-term consequences and disagreements occur when test results differ from one ethnic group to another. It is basically fruitless to adapt the same test for applicants from different cultural, educational, and social backgrounds. Important concerns include, among others, that psychiatric clients may be overdiagnosed, students disproportionately placed in special classes, an applicant unfairly denied employment or college admission because of purported bias in standardized tests. The issue of cultural bias. The problem of cultural bias in mental tests has drawn controversy since the early 1900s, when Binet's first intelligence scale was published and Stern introduced procedures for testing intelligence. Binet and Simon, 1916-1973, Stern, 1914. The conflict is in no way limited to cognitive ability tests, but the so-called IQ controversy has attracted most of the public attention. A number of authors have published works on the subject that quickly became controversial. Herenstein and Murray, 1994. IQ tests have gone to court, provoked legislation, and taken thrashings from the popular media. Brown, Reynolds, and Whitaker, 1999, Reynolds, 2008. In New York, for instance, the conflict has culminated in laws known as truth in testing legislation, which some clinicians say interferes with professional practice. Resistance to bias. The Association of Black Psychologists in USA issued a policy statement that fully supported parents who chose to defend their rights by refusing to allow their children and themselves to be subjected to achievement, intelligence, aptitude, and performance tests, which labeled black people as uneducable, placed black children in special classes and schools, potentiate inferior education, assign black children to lower educational tracks than whites, deny black students higher educational opportunities, and destroy positive intellectual growth and development of black children. Cultural factors in diagnosis and treatment patterns. The current trend of misdiagnosis following the non-culture-oriented test methods which were adapted for Western countries, premeditated impressions or stereotype and lack of regard to traditional beliefs result to treatment interventions that serve as little as less than temporary relief. There is now much need for a reassessment of the limiting and often complicating influences of traditional beliefs and attitudes in the definition, diagnosis, and treatment of mental disorders among Africans. This is so because the educational and health systems in Africa are yet to become familiar with the added implications of the growing socio-psychological, environmental, and spiritual factors in the development, dimension, and treatment of most patterns of illnesses today.